We all experience stress in our daily lives, but when does it become a health hazard? To talk about a new effort to help expecting mothers manage and reduce toxic stress, I'm joined by Anne-Marie Knight, Vice President of Community Engagement and Chief Diversity Officer at UF Health Jacksonville. Welcome, Anne-Marie.
Good morning. Thank you.
Thanks for being here. Dr. LaRae Brown, Medical Director at UF Women's Health, who also teaches obstetrics and gynecology at the UF College of Medicine, Jacksonville. Welcome, Dr. Brown.
Thank you.
And Kamala Williams, President and CEO of the Lotus Flower Project. Good morning, Kamala.
Good morning.
Thanks for being here. So we all know that there are some stark health disparities when it comes to people of color in the U.S., especially Black women and children. Dr. Brown, what are the causes of this?
Yeah, so thank you for that question. Just some brief information regarding that. You know, in our nation, state, and especially in our local community, there are certain zip codes where our infant mortality rates are just through the roof. And we understand that infant health and the success of pregnancies and their outcomes are directly related to maternal health. So we really have dived deeply to kind of understand that. And it's complex, but at the root of it, we do acknowledge that chronic toxic stress can play a huge role.
And explain what toxic stress is, as opposed to just the stress like I missed the bus or my homework's overdue.
Excellent question. So if you put stress into three buckets, there is positive stress, and that's, you know, the stress we have each morning when we're trying to rush out of the house and get to work or get to school. Then there's tolerable stress. So, you know, an impact of a death in the family. So you can get through that with support, but it doesn't necessarily cause lifelong effects. Then there's chronic toxic stress, which is just unrelenting chronic issues associated with an impact to the physiologic state of your body. So it ranges from stress related to socioeconomic status, racial discrimination, healthcare disparities.
Okay. And what do we know about how that impacts a mother or an expectant mother, particularly, you know, with a child in utero?
Yeah, good question. So if you imagine that chronic toxic stress creates a chronic fight or flight syndrome, that definitely changes the way our body processes stress in our interaction with having a healthy life. So those impacts can directly affect your cardiovascular system, where it raises your blood pressure and in turn changes the way your heart function. It can change your ability to fight off infections. So chronic wear and tear on your body can lead to those physiologic changes. And then during pregnancy, one of the most vulnerable times in a woman's life, we can see those harmful effects, thereby impairing maternal health and directly affecting our babies.
Anne-Marie Knight, what do we know at this point about how Duval County's infant mortality rate compares to the rest of the country, the rest of the state, the rest of the world?
Right. So if you were to go out to our Florida health charts, you would see that there's a significant gap between African American and other women across our community. Our gap is increasing, unfortunately. For example, when we look at 2020, the gap between infant mortality was 7.95, and now we're slightly increasing to 8.35. So while we have made great strides in our city, across our city.
That number represents per thousand?
Per 100,000.
Per 100,000. So explain to us what those two numbers mean and how those compare to people who are not women of color.
So what that represents is per 100,000 women, 7.95 in that example, children or infants were lost over that period of time. So it's a statistical way to level set the data across all data points across the nation and across Florida. So what it means to us is we focus on, you know, doing the work and engagement to reduce infant mortality of each race group, but then we also have to pay attention to the gap between the groups. So the gap is very significant for African Americans versus Caucasians.
So you're saying that overall the rate is almost 8, and for African American women it's more than that.
So let me give you the example of 2020, 12.75 for African American.
So nearly 13 children per 100,000?
Right, in Duval County. For Caucasian women, 4.8.
Okay.
So that's the gap of 7.95.
Gotcha. So the difference between almost five children dying
to 13.
To 13. So that's really significant.
That is really significant.
And so the understanding is that toxic stress is one of the contributors. Is it the main contributor to that disparity?
No, as Dr. Brown has alluded, there's other factors, right? So this is talking about infant mortality, and then the toxic stress of the mom impacts the maternal experience. So there's, of course, health access would be an issue. There's impoverished communities. What access resources do they have across the community? And for our particular work that we're focused on today around toxic stress, what's happening in the mother's world that she can control or respond to help reduce infant mortality in her time?
Kamala, the work that you do at Lotus Flower Project helps women who are experiencing high levels of stress and offer some programs. What kind of things help alleviate that stress?
So we've connected with UF Health in fostering community. One, so that women know that they're not alone and that stress isn't taboo. And so we bring them together to talk about that stress and to educate them on ways to reduce that stress, and then give them some tangible resources that helps alleviate that natural stress that women have every day about things like diaper needs, toilet paper, paper towel, laundry detergent, clothing, baby clothes. Those things women often stress about. We provide those tangible resources for them after that education piece. So community building so that you know you're not alone, and then some tangible resources to walk away with to help alleviate some of that that stress. And then also outsourcing other deeper rooted stress like grief. So offering coping sessions and workshops to deal with grief, the loss of a child, the loss of a loved one, the loss of a job, the loss of a lifestyle. We know that grief is not just the loss or burial of a person, but it's the loss of many things. And so offering those coping classes and workshops as well as the community.
And as well as the actual items if they're in need.
Mm-hmm.
Well, we're talking about the impact of toxic stress on expecting mothers and their babies. You can join our conversation live on air by calling 904-549-2937. You can also email First Coast Connect at wjct.org or reach out on social media. We're going to have to take a
Hungarian Pen, dedicated to agriculture and culinary endeavors, offering field-to-fork dining and outdoor experiences on over 300 acres. Sip, dine, explore. Information at congareeandpen.com.
North Florida TPO, proud sponsor of WJCT's First Coast Connect, bringing to the community innovation in transportation planning, commuter services, clean fuels, and intelligent transportation systems. More at northfloridatpo.com.
On the next Florida Roundup, climate change on your TV weather forecast. Heat advisories, a more active than normal storm season. Some local TV meteorologists are weaving climate change reporting into their regular weather forecasts. State agencies no longer have to consider climate change under a new law. How do you feel about climate change comments creeping into your weather forecast? Email us radio@thefloridaroundup.org. I'm Tom Hudson. Then join us Friday at noon.
$640 million Indians went to the polls to vote, and the results are in. Many voters sent a message to India's authoritarian leader Narendra Modi. We're over it.
Maybe they're not kicking Modi out of power, but they are sending an unmistakable message to the BJP that you can't do whatever you want.
How Indians clawed back their democracy, coming up on Today Explained.
Tonight at 6:30 here on WJCT News 89.9.
Thursday marks the 80th anniversary of D-Day, when over 150,000 Allied troops landed on the beaches of Normandy. Tomorrow, we speak with historian and author Garrett Graff about his new book that spotlights some of that day's heroes.
My uncle, Richard C. Andrews, delivered troops and took wounded back to ships on D-Day in Normandy.
What D-Day was like for the people who lived it. Next time on 1A.
Today, starting at 10 on WJCT News 89.9.
Welcome back. We're talking about the stress impacts that affect maternal health, that affect outcomes for infants. And you can join our conversation if you want to give us a call at 904-549-2937. You can also reach out on social media or email us. Dr. Brown, the issue of toxic stress, it isn't something you've just seen in patients. It is something that you personally have experienced. Talk about your own lived experience.
Yeah, thank you. So I am not only a full-time OBGYN, but my most important job is to be a mom. And I do have, me and my husband have 6 children. So as you can imagine, I've had a myriad of experience and interaction with healthcare, and both the environment that I have lived has definitely created an interesting conundrum. So I'll just briefly talk about my last delivery. So I have a 2-year-old daughter now. So I am juggling full-time job, raising 5 children, full-time wife, daughter, aunt, sister-in-law, and sister, on top of a very stressful career and profession. And then all of the things that are surrounding us in our nation, in our world. And that's a very important concept for us to realize, that even people who seemingly have access to lots of resources, or seemingly have access to excellent access to healthcare, there are still certain factors within our culture, within our society, that can predispose us to poor health outcomes, or at least put us at risk for those. So identifying that, like Kamala mentioned, the awareness, the education surrounding that can definitely be helpful. So for my example, I have access to care. My physicians are my best friends. You know, I work and live in the hospital essentially. I have prior knowledge. I have access to food, education, medication. But even with my last delivery, there were some moments during my hospitalization where my husband was very concerned about the possibility of me making it home. And it's not directly related to how much I exercise or how great I ate, or my access and the equity that I was able to achieve, you know, being in my specific position, but a lifetime of chronic stressors, a lifetime of just being a Black woman in America could have predisposed me to, you know, differences in that. And we see that in the data. You know, a Black woman with a college education has the same mortality rate as a uneducated, no high school degree white woman in our country. So there's a lot of underlying things that we are still figuring out and learning together. So education and awareness is just the first step.
And Kamala, in the work that you do, you have received feedback from people who have been gratified for the lessons that they learned. Even people who represented themselves as a good advocate for themselves in the healthcare system found that they were really, in a serious way, in an effective way, empowered by what they learned from going through some of the education.
Yes. Recently, we received what we call a testimony from a participant who participated in our program, and basically said that, you know, she was there not thinking that she needed that education, because she advocates for herself often, you know, and that she's a good advocate for herself. And because she participated, she received the free blood pressure cuffs that we provide and weight scales that we provide. And she wasn't feeling well. She's pregnant, wasn't feeling well, went to a doctor, and they didn't run any, you know, tests. And so she kept monitoring her blood pressure with the monitor that she received at our program, and it kept rising and kept rising. And after another visit to the doctor, she learned that, you know, she was at risk. And it was because of that education that she received, because we talk about getting a second opinion. We talk about asking questions. We talk about not allowing doctors to just dismiss how you're feeling. We talk about, yes, every pregnancy is different, but you still can ask questions. And because she advocated for herself, she saw and got a second opinion. The guidance that we gave and the discussions that we're having saved her life.
Because her initial response that she got was, you should just drink some more water.
Mm-hmm.
Yeah.
Exactly.
And Anne-Marie, this program is part of, you know, a community-wide effort that is addressing the issues of toxic stress, maternal health, infant mortality,
That's right.
writ large.
Absolutely. I mean, I see you had the mayor here earlier. She specifically has this is one of her platforms and areas of interest. There's Northeast Florida Healthy Start Coalition, who Faye Johnson is a leader in this work. So we're just part of the team. We've come together with our assets, with our resources and support, and said we want to participate. We want to go upstream and engage with women pre-conception and just talk with them, sit with them, provide resources, and help them in their journey and their understanding of how stress will impact their body.
And so you're talking to women who aren't pregnant, even people who are thinking
Absolutely.
that they're going to get pregnant.
Absolutely.
And that's a time for intervention even at that point.
Absolutely. preparation is key.
Yeah.
It's not simply about that prenatal experience when you're pregnant and making sure you have certain resources. It's also prior to even that decision of becoming pregnant.
So if someone is thinking about becoming pregnant or they are pregnant, where can they go to find information?
Sure. So they could contact us. We can be reached at 904-244-8415. The UF Health Jacksonville website, Urban Health Alliance, has our Life's Course program there. The email address is uha@jax.ufl.edu as an education.
Anne Marie Knight, Dr. LaRae Brown, Kamala Williams, thank you so much for being here this morning.
Thank you for having me.
We appreciate it.